Hello and welcome to the Happy Healthcare Professionals live show. It is Komal. I hope you are well wherever you're joining from, whether it's on LinkedIn or YouTube or on Facebook. It's so lovely to have you here, and do say hello in the comments and let me know where you are joining us from. If you're new to the show, let me introduce myself. My name is Komal. I am a career coach and a business strategist for pharmacy professionals. And I absolutely love helping pharmacy professionals to create their own careers that they absolutely enjoy and help them to make an impact on patients' lives. And so I love interviewing people on my show. If you have watched the show before, then you will know that that is a very common feature of the show. And today is no different. In fact, today's really extra special for me because on today's show, we have got one of my past clients, Lara, who is a clinical pharmacist and an Ayurvedic practitioner. And she is on a mission. She's on a mission to help women with endometriosis to manage their condition naturally and support them to live a life that is fulfilled. So I am so excited to have Lara on the show, and I'm going to bring her on screen now. Hi, Lara.
Hello. Hi. Hi, everyone.
How are you doing?
Very well, thank you. How are you? It's lovely to see you again.
Yeah, you too. You too. I mean, you know, I just have loved seeing your story and your journey unfold. And I've had lots of people actually who have said to me, I'm really interested in Lara's story because I think you are the first clinical pharmacist from the UK that I've had on the show who's doing something that's a bit more holistic. And, you know, I'm a big fan of, you know, and a big advocate of holistic therapy and, you know, us kind of molding that with us as clinical pharmacists and pharmacists in general and pharmacy professionals. So tell us about your story.
Oh, well, I just think pharmacists are so well placed to be more holistic. And so I basically started out, I've always loved both medicine and holistic health. So myself, I have asthma. And I think this is the first thing that got me into medication was, what is this thing that I take that can take me from potentially life-threatening symptoms to feeling fine in a couple of moments? So that is why I decided to study pharmacy. So I went to Reading, did my master's there, and I knew I wanted to work in hospital. And actually, I didn't even realize that pharmacists could work in hospital until sort of my third year at uni. And I was like, wow, I want to do this. I didn't realize, I thought I was just going to go and work in Boots. So as soon as I was like, okay, I'm going to do this. And I feel for me, I aimed quite high, and I knew I wanted to go to London, but I only sort of put one London hospital on my list, and I did the other 3 out of London because I thought, yeah, I'm not probably not going to get London, so I'll only put one down. And I did my pre-reg at St George's, which was amazing. I loved having, I think they take about 13 pre-regs, so I did that there, and it was really amazing. I knew I wanted to be at sort of the forefront of medicine, and I definitely got that there. It was so inspiring. So I then stayed on and did my band 6 there, did residency, which was amazing, but very stressful, very draining. And that was the first time that I sort of thought, is this something I can see myself doing forever? Can I really take on this pressure and the demands of this job? And especially working by yourself in a 1,000-bed hospital, taking all those calls. And interestingly, on my first ever night shift, I got a major incident, which would never happen. And we got very little training on it, but it happened on my first shift. So that was quite an interesting one, but great to sort of work on your feet. Yeah. So that kind of affected my health a little bit, working nights, just feeling quite burnt out and sort of being a little bit just sort of realizing that modern medicine is amazing, but I don't know if we can call it modern medicine anymore, because it's not actually fitting the needs of the majority of people. Yes, it's amazing acutely, but chronically we don't have a lot to offer. And that I didn't really realize that until I started really working on sort of like acute care wards. You start seeing the same patients over and over again, and that made me think, look, something's not right here. Yeah. And then with my own health as well, I just thought there's something else that I want to be doing. I want to include everything. And my mum always used holistic medicine on me when I was younger, so I decided to have a look at that. And that's when I found Ayurvedic medicine, and it was just a perfect fit for me. I just knew it was something I wanted to study.
Amazing. I mean, you know, I can totally relate to the working in a busy clinical hospital, because I did my pre-reg at St. Mary's, and it was similar, you know, lots of pre-regs, lots of departments, lots of pharmacy departments, even within the hospital, right?
Little satellites, just.
Yeah, and you know, you're kind of moving around every few months and experiencing them all. But it is a tough environment to work in, you know. It is full on, right?
Yeah, very full on. And I didn't quite realize that, how sort of, amazing how involved we are, but I didn't quite take it all on board until you're really thrown in the deep end. And that transition between being a pre-reg and getting everything checked off and countersigned, and then the next day it's like, oh, it's fine. Yeah, I'd met the check. Go on, sign it. And I was like, really? Ooh.
The imposter syndrome's like through the roof at that point, isn't it? It's like, can I do this? Do I have the right to do this? Yeah. Am I qualified?
You get used to it, don't you?
Yeah.
Well, you have to.
Absolutely. You know, as you say, getting thrown into the deep end, right?
Yeah.
So Ayurveda, I mean, I obviously know Ayurveda because it's really, I've grown up with it in many ways, and it's part of my heritage and background and history. And so, you know, I often say to people, I can't really separate myself from Ayurveda, because it's it's part of my culture. And actually, when you start studying it, when you've lived in that culture and you start studying it, you realize just how many of the practices, everyday practices that you know, rituals that are part of your life are, you know, originate from Ayurveda. So tell me about this journey with Ayurveda.
So it was probably about a year into my residency that I sort of started to feel a little bit burnt out, and I wanted to take some time off. So I actually went to a retreat in the Arizona desert.
Wow.
Middle of nowhere, and sort of connected with a lot of holistic practitioners there. And that just got me thinking, I need to really, really look at what I want to do. And that just blew my mind open in terms of the connection that they have, like the Navajo tribe that was living there, back to nature, and everything was worship, everything was sacred. And I really liked that. And I was already practicing yoga and sort of dabbling in meditation and things. So I looked initially at Western herbal medicine, but something was sort of missing. I wasn't quite connecting with it. I found it sort of viewing the body as the West does, but just adding herbs in. And I was like, no, that's not deep enough. I want more. I want to really look at the body in a completely different way. And I actually don't know how I found Ayurveda. I sort of think it found me. I don't know, flashed up on the internet, this course.
As it does.
I can't remember how I actually found it, but I knew instantly. And the woman called me back, and I was just like, can I sign up now? Like, now I want to do it. And yeah, ever since then, it's just clicked so much. In terms of that connection with nature, and everything that we know that's good for our health, we can draw back to Ayurveda, like that connection with nature. Just everything that surrounds it is, meditation, going slower.
There's been this real focus, right, on just living more holistically. And I suppose, you know, ultimately, you know, we always can't keep coming back to COVID, but it's still here and it's still part of our life, right? And so it's kind of brought it to the fore, right? Definitely. And, you know, in some respects, where, you know, where we went into lockdown and people were kind of stuck in their houses and that, you know, you couldn't get into, you know, you couldn't go anywhere. It made you rethink your lifestyle and how you live and how the life that you were living pre-COVID might be affecting your health. But at the same time, I think there's been this kind of shift amongst us in society where we're kind of like, we want the NHS to be there when we've got something that's acute. And so we want to be in a position where we want to be able to look after ourselves on a, you know, on a long-term level, right?
Yeah.
And that's really, I've certainly seen that in myself, and I've seen that in people around me. Have you seen that as well?
God, definitely that empowerment and taking back control, and just knowing those little things that you can do for yourself. It just changed so much about your health. Just even the tiniest things, setting a routine, going to bed at the same time. And often when I see clients, I strip everything back because they come to me saying, I've cut XXX out of my diet and I do all these things and I take all these supplements. And I was like, but are you going to bed at the same time? Are you getting out in nature every day? And are you just going for a walk? And it's often those things that we forget to do. And we jump straight to but I'm taking ashwagandha because I've heard that's amazing. And I'm like, it is, but we need to get just the real basics right first, and then we can build on that. And I think we always think it has to be really complicated, but it doesn't. It really doesn't.
And how did you find this journey, like, of going from clinical pharmacist to Ayurvedic practitioner? Because I put in the blurb about today the fact that when you first contacted me, you asked me about whether to let go of your GPhC registration, didn't you?
Yeah.
And, you know, and my answer to that was pretty straightforward. Don't do it.
No. My question around that was, am I going to seem less credible and less into Ayurveda and less holistic if I'm a pharmacist as well? Are people going to take me seriously? Are they going to think that I really understand what holistic medicine is? And I actually thought it was going to hold me back. But no, as soon as you said that, I was like, right, this is clicking here. I need both. I need to work on both sides and really combine the two together to make something really unique. But it was definitely hard transitioning out of a full-time job, because I think potentially I jumped a bit too soon. Now I know I didn't, but at the time I was like, well, why am I leaving now? Why am I leaving NHS? I feel very supported, but I just felt that massive pull to do this work and do it now. And I think obviously COVID didn't help with that, sort of pushing out a little bit. And I knew if I didn't leave then when am I going to leave?
Yeah. So what happened when we first, because we first connected with each other earlier on this year. Where were you at that point?
So I left the NHS in October 2020, having no idea how hard it was going to be. I thought starting a business was you do the work and you do your own taxes. That's what I thought running a business was. So, you know, that saying, it's like unconsciously incompetent. I was definitely that. I was like, right, I'll just tell everyone this is what I do and clients will come to me and it'll be amazing. Yeah, not quite. And I did a business course before, which was definitely helpful because it highlighted what I didn't know, which I think was really important for me at that time. But then I sort of knew small things about what I needed to do. But when I came to find you, I was just all over the place. And I remember saying to you, asking you whether I should do another course. I was thinking about doing Western herbal medicine, which was going to be another sort of huge investment with training. And I thought maybe if I just do a bit more training, a bit more specialized, then I'll be able to find clients and do the work that I'm so passionate about. And you were very clear with me, which is what I needed, to be like, no, Lara, you need to focus on your business and things will work out. You just need to trust in this process and get the foundations right. And then we can move on from there. And I remember our first call, we were sort of doing our discovery call, and I had already said in my head, I was like, whatever this woman is going to charge for, it's going to be amazing. I've already signed up. So.
Oh, bless you. I mean, you know, I remember that first call, and I remember how you know, you describing this kind of you being all over the place and, you know, just kind of like thinking, okay, well, maybe I need to do another course. And that's such a common, it's such a common thinking for us as, I think, as healthcare professionals, just because we're used to learning. It's like, it's part and parcel of us, right? We're used to being in this learning cycle, this constant learning cycle. And we often fall into this trap of, the more I learn, the more I will know. And that's true. Yeah, absolutely. It's true. But actually, we forget that we learn so much more from our experiences and from taking the action, right?
Yeah.
You know, and having those conversations, you know, when you, even in the clinic as a clinical pharmacist, right? You learn all these things in theory, but it's not until you have a patient sat in front of you and you're having a conversation with them that all the theory starts to fall into place, right?
Yeah. And you're never going to be a good pharmacist from books, and you're never going to be a good Ayurvedic practitioner from books. It's, yeah, you've got to implement it. But I think for me, it was a way of putting off that hard work. If I could say to people, oh, I don't have many clients, but it's fine because I'm now doing this new training. So it's like, if I can stay in education forever, it puts off having to do this business work, because I know I don't have a business head naturally. I've learned so much through you that I've put into practice, but naturally it wasn't there. I don't think talking about money and those sort of things came naturally to me at the start anyway.
Yeah. And so talk about your journey, because at the beginning you were kind of thinking about which kind of clients am I going to work with, and you know, you had an idea about working with women with endometriosis. So talk me through that kind of journey that you went through.
Yes, I think obviously our training as a Ayurvedic practitioner is everything. We treat all conditions, because it's very much on the imbalances of the body rather than the constraints and labels of syndromes or diseases as we would in the West. So I went into it sort of like running, being like, I can help everyone. I'm really good. Everyone come to me. And sort of that thing where you're speaking to everyone and you're speaking to no one. So it started out a lot with sort of IBS clients. I had a lot of those. And then, as you do in a holistic consultation, you always ask women about their periods, and they would always say to me, "Oh, they're painful, but it's fine. It's a normal amount of pain." And I was just thinking, God, if we're saying this is normal, we're telling ourselves it's normal, we're not actually doing anything to fix this situation, and that just perpetuates the women that do have that severe pain. When they go and get help, they're told it's normal as well. So no one's actually getting the help that they need. And that's pushing these awful time to diagnosis for women with endometriosis up to 10 years. And I had severe primary period pain myself. I don't have endometriosis, or I don't have a diagnosis of anything. But I knew how painful they were to me. And I thought, if I had this every month, or even some women have pain throughout the whole month, don't they? So I just thought, what is being offered to these women? And the pill, no. Surgery is not available to everyone, and not everyone wants surgery either. So I just felt this like burning desire to help these women. And I sort of had decided that in my head. And then all of a sudden, these women started coming to me and saying, do you treat this? And I was like, that's really interesting that I've put that sort of energy out there, and they're now coming back to me. So, and I just found that Ayurvedic medicine works so well for these sorts of women. So yeah, it's been a bit of a journey. But once I had that sort of straight in my head, with your help, who am I going to help? Then things start falling into place. You're talking to that one person.
Yeah.
And things just start to flow.
Yeah. Because, you know, you really honed in on that. And this is one thing that I think a lot of pharmacists feel really fearful of, because, you know, even as a pharmacist, you can treat anyone really. Like, you know, we've got a real clear pathway in hospital where you can specialize, but most of us are generalists, aren't we? And so it's kind of like, you know, so easy to fall into this trap of, okay, well, I'll just help anyone, you know, and whether you're an Ayurvedic practitioner like yourself, or whether you're an IP pharmacist, you know, or whether you're focusing on another holistic therapy, it's so easy to think, well, you know, I can help anyone and everyone, and you absolutely can. But it's about making sure that you're actually speaking to a person, right, who has a problem, and supporting them that way, right?
Definitely. I think for me, it was coming from a bit of a place of fear. If I only treat this one condition, I'm going to be, how can I support myself? I'm losing out and not being able to help all these other people. And am I going to get bored? There's so many negative things coming at you from every angle that you don't think about the possibility and the benefit that you can have. And gosh, I wouldn't go back to treating everyone. I just find I'm so focused and so passionate about this road that I'm going down.
And that, you know, when I saw that clicking in you, it was just amazing. I was like, yay.
And then the confidence that comes with it as well, because I just don't feel I had much confidence. I had confidence in my ability, but not in the sense of being able to get the information out there and letting people know that I can confidently help people with this. I was sort of hiding behind in my shell a little bit.
Yeah. And so what's happened since, you know, because we worked together for 6 months, didn't we? And, you know, where were you at the end of that 6 months?
Gosh, I was thinking about this earlier, and I just couldn't believe it was 6 months ago. I was thinking that it was June 2020, and I was like, oh, so it's been a year and a half, and that's a lot of change in that time. And I was like, no, it's 6 months ago. It was this June this year. So the changes have just been, gosh, so powerful. I think confidence is a huge thing, as I said, knowing that what I've got to say is valuable and it's really helping people, and I can really stand in my power of being able to do that. And talking to that one person and being really, really focused, and having a plan, a roadmap of knowing where I need to go, what the next steps are, rather than like spreading myself in so many different directions. Because at one stage I was thinking, I'll do Instagram, and I'll start a Facebook group, and I'll do all these other things, and there was just no focus on one path. Whereas now I know these are the things that I need to do. These are the ways that I can get leads and clients coming in, and that whole process of feeling really confident with what I'm selling, and it's been such a change. And even talking with potential clients and saying, you know what, I actually don't think I'm the best person for you. I think maybe this would be better. And I was like, gosh, that's such a sign that I'm so confident and so relaxed with what I'm doing, that client or that person comes before anything else. And their needs are the first thing. And that was a really big sign that things are right. Because I know there's going to be so many more potential clients coming behind that are going to be the perfect fit, that I'd rather this woman gets the perfect treatment for her. And they do, has to be right.
Yeah, absolutely. We've had some really lovely comments actually. So I'm going to pick up on some of them. Sunil said, knowledge is power, but delivering the knowledge for positive outcomes has greater power.
Yeah.
So true, right?
So true.
We've got to put ourselves out there, and you know, by getting those positive outcomes, we get greater power. There's no doubt about it. And you've seen that for yourself, right? When you've been working with these women and supporting them and seeing the changes that they've experienced with their condition, it empowers you more, right?
Yeah. And you even learn so much from when things don't go the way that you thought. Yeah. I've learned probably way more from that than anything else, and anything going seamlessly. From just having to make little tweaks and getting things back on track is, gosh, you learn so much from that.
Definitely. And Yusuf, thank you, Yusuf, for your comment. Honorable confidence is one's ability is such a vital and helpful skill to develop and practice. Yeah, I mean, you know, confidence. I think confidence is such a big issue for us as pharmacists, and even, it takes a lot of courage to do what you've done, Lara, to take that step and say to yourself, I'm going to marry the two things together. I'm going to marry my clinical knowledge with my real passion for holistic therapy. And it takes a lot of courage to do that. And you've done it. And it's, and it's shown that when you do it successfully in the way that you have, you can really make a difference to people's lives.
Yeah, it is. I've only just sort of started realizing and giving myself a bit of credit that actually this is something really unique, and there hasn't been any playbook to follow and do these next steps. So yeah, that's like, feel proud of myself for doing it.
Yeah, thank you so much, Yusa, for your comment. And Rajinder said, great tips, roadmap to where you want to be. Yeah. And,
those stepping stones.
Yeah. And that was that was one of the things that I think for you, when I saw, when we went through the process of the coaching, that was one of the things that really kind of clicked for you, right? Because you had those stepping stones in place and you were like, okay, now I know what to do next. Now I know what to do next, right?
Because it's so overwhelming. There's so many, gosh, and I list out all the things that we work through. It was just, if you hadn't have given me those stepping stones and those small actionable steps every week, there's just no way that you could do it. And I think that's why people do find it so overwhelming. There's so many amazing books out there to help, but there's no one actually saying, right, this is the next step that's right for you right now. Yes, those other things are important and you can do those one day, but just park that idea and do this. And I know some things you had to tell me quite a few times. Like one, like setting up my calendar, such a good idea. And I was like, yeah, that's great, but I'm not going to do that yet. And then like 3 weeks later, I was like, you know what, Kamal, I've started planning my calendar.
Yeah. Yeah. And, that's also okay. Like, during a coaching journey, there's things click into place at different stages. And often, you'll mention something or we'll talk about something and it's not the right time for you to implement that, but it's right for you to park it and say, okay, well, when the time is right, it will come to me. And that's exactly what happened with the calendar, right? Because we were like, right, you need to plan your calendar. And it didn't happen. And then 3 weeks later, you realize actually that's what I needed as a grounding
breakthrough. And that's actually been so useful for me to implement things like that with my clients, to say that I can say something and it's not wrong, it's just not the right time for them to implement it. And it's okay to suggest the same things again, because before I might have been like, well, I've already said that, I can't say that again because someone's going to think I don't have sort of endless knowledge. So yeah, repeating those same things and reinforcing how important that is.
Yeah, and it's really interesting because in holistic work, it's all about habit change.
Yes.
Right.
Yeah.
And a lot of it is helping the individual to uncover the habits that they have in place and perhaps the reasons as to why they're there in the first place. And then supporting them to make different choices and, changing things in a way that's right for them. And so habit takes time, habit change takes time, and we often have to, it's 2 steps forward, 1 step back, 2 steps forward, 1 step back often, with that. And so there's nothing wrong in repeating the same thing over again.
And also looking back at how far you've come and the changes that you've made. It's just been, so important to remind myself of that, the huge changes that I've seen in our 6 months together.
Yeah, I mean, you now have clients that come to you.
Yeah. And that
didn't have it before.
Yeah, I felt like I was before, like just sort of desperately hunting and being like, where are these people? I know they're out there. And now it's just that like sort of sense of just relaxing into it and knowing that they do come and they drip through. And it's just been amazing to have that sort of slow and steady consistency. And it's exactly what I've been looking for. And I know each month that it's growing and things are getting easier and things are growing, definitely. Yeah. And I'm getting so much more confident on just every aspect of it, the calls as well. Before, if I had to plan out my calls so carefully, and now it's just like it's such a nice chat. And as I said, if we don't feel it's right, both of us, then there's no harm in saying, actually, I don't think this is right for you. And yeah, that's been a big change.
So what would you say to a pharmacist who's sitting in the position of you right now, who at least 6 months ago, who perhaps, is looking at doing something that's more holistic, who wants to be in that place where they want to marry the holistic, passion with their clinical knowledge? What would you say to them?
I think if your passion is there and it's what you want to do, then just absolutely go for it. There's endless space for people to do things like this, and whatever condition or space that you find that interests you. And getting that support for that transition is so important. And we have to remember that we have a lot of knowledge. We don't necessarily have all the knowledge that it takes to implement it into a business. And I think getting that support is so important. But know that we have so much to share, and that we're in the perfect place.
Yeah.
Holistically. And I think for me, doing what I do, being a pharmacist, it brings instant credibility to what you do. And for me, what I've tried to do with your advice is getting links with gynecologists.
Yeah.
And that has been a sort of real game changer for me, because it's obviously good for us to know from a clinical standpoint that this is the right patient, and everything's already been investigated. We know that we're not going to miss something
major,
exactly.
Yeah.
So having that confidence that this is the right treatment for them, I think is definitely really important. And that is the way we slowly break into this big box of a medical system that wants to keep all holistic practitioners out, because it's not, the changes are not going to come top down. They're going to be from people leaving the system, making amazing changes, and then filtering back in. And that's how we do it, because we need it. We need holistic practitioners in all chronic conditions, definitely.
Yeah,
more often.
Totally, 100%.
Yeah, I've had a lot of people actually message me being like, "I love what you do." Oh, and like, "Oh, I can never do that." I was like, "Oh yeah, you can. You definitely can if I can do it."
Like, get in touch with Komal.
You can definitely do it.
Yeah, no, absolutely they can. And you're testament to it, that you 100% can do it. And it requires that roadmap ultimately, of working out exactly who you want to help, how you want to help them, and speaking to that, right?
Yeah.
So Megan has said, great inspiring journey. There you go.
Oh, thanks, Megan.
And somebody else who I don't know who this is, but so inspiring, looking to do an acupuncture degree, and everything you've said resonates with me. Oh wow, amazing. Acupuncture, that's amazing.
I'm so interested in acupuncture, and maybe that'll be my next thing I dabble into. But I've said to myself, Lara, get your business up and running, get your monthly revenue where you want it to be, and then you can look at doing extra things. But I know I'm going to be a student for life on all holistic things, and Ayurveda especially. But yeah, get the foundations of the business, which are there, get them growing.
Yeah, it's just amazing. Having seen your journey and just seen how you've literally flourished, and you've created this incredible business, where you are making such an impactful change in women who suffer from endometriosis. And it's just amazing to see how you've grown. And I want to see more pharmacists like you, doing things in that holistic way. And really, as you touched upon, disrupting from the bottom up, which is what I like to call it. And because disruption never starts from the top, it starts from the bottom.
No, it won't. And it's, I mean, with endometriosis as well, it's the patients and that are making this disruption. They're demanding better treatments, and they shouldn't have to advocate for themselves, but they're being forced to because treatments aren't good enough.
Yeah,
that is how change happens. Saying I'm not accepting this. what else is there to offer? And I really hope one day that they'll say, oh, holistic is what you can do alongside surgery, or whatever best suits that clinical situation. But I really think it needs to filter in.
So where do you see Lara Ayurveda going in the next year or so?
Oh, good question. Well, I'll be full with my clients. Definitely.
Well, that's going to happen soon enough. That's going to happen way sooner than a year.
I need a bigger vision, don't I? Yeah. So one thing I'd like to do would be to go into schools and talk to sort of preteens about what is normal, what is not normal. Get some really strong links with gynecologists. Really get them involved and write up my case studies and present them, and to put a case forward for if there are women that are interested in this holistic approach, we need to give it to them, because at the moment we're saying the pill or surgery or nothing, and it should be surgery for the ones that need it and where it's indicated, but also the holistic approach as well, because often surgery is not going to be enough. So it should be involved for every case if that's what that woman chooses. But just that there's no access. People don't know that this exists. So need to get it out there. Need to get talking to more doctors.
I love that mission. You know, especially speaking to young girls about their period and getting, helping, supporting them to understand what's normal and what's not normal. It's at that stage that it starts, right?
Yeah. And initially I was thinking, I'll talk to girls that age, but I was like, no, I'm going to talk to girls and boys, because these are going to be our future doctors. And if we can get the boys on board as well with what is normal and what is not normal, then in 10, 20 years time, a woman goes and says to her GP, look, I'm in pain. That is when we can get the ball rolling, not send them away and force them to come back when they're struggling to have a baby, or the pain is just so excruciating. It's just not acceptable. So big changes need to happen, definitely.
I love that mission. I absolutely love it. I think you're going to literally just absolutely transform, how we think about endometriosis. And I cannot wait to see where this journey takes you, Lara. I really can't. It's just been an absolute pleasure to work with you and see you grow. And I'm just so happy for you.
Yeah, stumbling across your page, honestly, the best thing. And you suggesting that call and everything just clicking and just, and it feels right. In one of those situations, definitely. I don't know. I think I would probably be somewhere doing another course and not having any clients and still trying to treat everybody. And I definitely wouldn't be where I am today. That's for sure.
So where can people find you, Lara?
So I'm on Instagram. So it's at Lara Ayurveda. That's the same as my website as well, laraayurveda.com. My email address is on there. All my information about what I do and the package that I offer. So I do a 12-week program for women that includes everything, all the aspects, all the sort of physical, mental, emotional sides, herbal medicines, everything. I just wanted to wrap it up into a lovely package and give this to women, something very different. So yeah, come and find me there on my website, send me an email. Would love to hear from anyone that's interested.
Yeah, amazing. Thank you so much for coming on the show today. I really appreciate it.
Oh no, thank you for having me. I really enjoyed chatting to you.
And I cannot wait to hear of all the successes for you over the next year. Thank you so much. I'm just going to put this one comment up that Meghna said. That's so powerful, and changing NHS treatment to include holistic options will be such an amazing improvement in patient care.
Yeah, definitely.
That's what we want. That's what we're going to advocate for, right?
Yeah, we need both sides of it.
Absolutely. Definitely. Thank you so much, Lara. I really appreciate it. And I'm going to see you soon.
See you soon. Bye-bye.
Bye. That was Lara. I have so enjoyed my journey working with Lara, and she has just absolutely flourished. And if you are watching this today and you are a pharmacist or a pharmacy professional and you're interested in developing your own business that is holistic driven, then get in touch with me. It would be my absolute pleasure to help support you in getting that business off the ground and creating something that's going to make a massive impact on people and is going to change their health and their lives. So do get in touch, and I will see you on the next Happy Healthcare Professionals live show, which is going to come back in January of 2022, because I'm going to take a bit of a break now and spend time at home with my family over Christmas. And I hope you get to do the same too. So I wish you a very, very Merry Christmas and a Happy New Year. And I'll be back in the Happy Healthcare Professionals live show in January. Take care. Bye.